at 11 and streaming on CBSN Bay Area is key to getting back some semblance of normalcy. City leaders have said over and over we need to have large-scale testing of COVID-19. Good evening. I'm Ken Bastida.
And I'm Elizabeth Cook. Tonight, we have learned the testing capacity for San Francisco has expanded, but relatively few tests are actually being performed. Joe Vasquez looks into why in a story you'll see only on 5.
This property here along the Embarcadero is one of 2 free COVID testing sites called City Test SF. If you'd been here earlier today, you would have noticed what we've been seeing for days. It's largely devoid of cars or people, not very busy at all. This site along Piers 30 and 32 has been here for 3 weeks. Originally, they were only testing healthcare workers and first responders. The criteria has recently expanded to include folks who are symptomatic, showing signs of the disease. We also checked in on the second City Test SF site, south of Market on 7th Street. Again, not much traffic. We've observed very few people going through to get tested. Both facilities combined have the capacity of testing 1,500 people per day. But according to city records, only 2,000 people total have been tested at the 2 sites. This evening, Dr. Susan Phillip with the Department of Public Health told the San Francisco Board of Supervisors in a video hearing there is also a large gap citywide. She says San Francisco has the capacity to test 5,800 people per day if you include the public hospitals and other medical sites. But she says only 500 people per day are being tested.
We have seen the numbers of tests increase over the past few days, which has been good, but you are correct that there is a large gap still, which we need to try to close between the number of tests we're doing and the number of tests we could be doing.
If we can do over 5,000 tests a day, we should be doing over 5,000 tests a day. It is absolutely unacceptable to have just 500 being done when the capacity is much higher than that.
Supervisor Matt Haney says he wants the criteria to be expanded to folks who are asymptomatic, showing no symptoms. Also, he points out tests are by appointment only through a website, but not everybody has internet access, especially people on the street who are very much at risk of getting infected.
And we know that this is a huge way that we're going to actually open back up. We need to massively expand the number of people who are being tested before they're showing symptoms.
Dr. Phillip says the problem for weeks has been a global shortage of testing materials like swabs and media. But she says that supply chain has stabilized for now. So the city now plans to expand the testing criteria to include folks who are not just experiencing a fever or a cough, but soon you could get a free COVID test if you have a headache or a runny nose or even just fatigue. So far, no timetable on that expansion of tests. Joe Vasquez, KPIX 5.